So thank you so much. We have today, we're so excited to have 52 Weeks Marketing here. That's Grant Gaston and Debbie Miller. And I just wanted to tell you a little story. We were at a conference together. This is the Decision Health Conference in Las Vegas in November. And we were kind of fellow vendors. And it's the first time I had seen their work. I got to see a little bit of their software, and I was talking to Debbie about the plight of the agency marketer and the plight of marketing in general in the home care industry, and realized that their product is a great way of holding your marketers accountable. And to me, that is a key part of this whole process, and I'll let them explain more. But really great people have really put a lot of thought into this and are very, very expert in their field. So without any more delay, I would like to give that over to you, Grant. Welcome.
Thank you, Linda. Thanks everybody for attending today, and we thank Rosemark for the opportunity to present to you all. My name is Grant Gaston, and I'm the co-founder of the 52 Weeks Marketing local area marketing system, which provides you with the sales structure, the marketing materials, the sales system, and the CRM software to manage all the day-to-day referrals generated by your marketer and the leads that you receive into your office by your intake person. So putting them both together. It's, as we said, sales and marketing in a box. So I just want to go through what we're going to be covering today. We'll show you how to focus on referrers in the healthcare industry to really get your referrals growing. How having a sales system with dynamic materials will give you a business reason to meeting with referrers, and this will generate lots of business. And how the CRM software ties it all together and keeps your marketer accountable. And towards the end of our presentation, take you through some great takeaways that you can use literally tomorrow in your business, and outline some special offers for attending today's webinar. So
we're trying to advance our slide here. There we go.
So home care marketing ain't what it used to be.
Hey, Grant.
Yeah.
I think we might be looking at the wrong screen. We're seeing the 52 Weeks Marketing, and then to the side, next slide and no notes.
What does he need to do?
I don't think the presentation is displaying on the right screen. Do you have two monitors, Grant?
How's that?
Oh, there we go. That looks better.
Okay.
Okay.
So home care marketing ain't what it used to be. Let me just talk briefly about Debbie, and she'll talk more about herself shortly when I hand over to her. But Debbie's built an 11 million company in 10 years. So she brought her pharmaceutical marketing experience to the home care industry and designed the system and the materials around what she'd learned way back then that are very unique in the home care marketing space. She pioneered the 52 Weeks Marketing system in 2010, and with a team of 4 marketers, was reaching into a community of 1.6 million people. So her team generates on average 92 referrals each month, with many of these becoming big cases ready to start immediately. And worth noting is that 97% of her new business comes from the 52 Weeks Marketing B2B program. So she still has a little bit of SEO and pay-per-click, but it's but the marketing this system's taken over from there.
There we go.
And a little bit about myself. I've had a very strong background in home care franchising and sales management systems, so I bring that to the table with 52 Weeks Marketing. So what I've done is really commercialize this amazing system that Debbie has developed, but I've also been instrumental in developing the software system that I'll cover today. That's a CRM software system that tracks every interaction that your marketer's involved with and keeps them accountable. And there's a whole bunch of exciting reports and other features and functionality that go with it. So my expertise is also in corporatising home care businesses in both Australia and in the USA. So with that, I'll hand over to Debbie.
Okay, well, good afternoon, everyone. I am so excited to be with you all, and I thank our friends from Rosemark for inviting us to attend and giving us this opportunity to present to you all. I am so excited about being a home care provider right now. I think that this is the dawning of a whole new era for us providers, because for the first time since I've been in business, healthcare providers, ACOs, hospital administrators finally have ears to hear about what home care providers bring to the table. So it's really time for us to stand up and take our place in the care continuum as a true partner in patient care. So let's take a look at what's happening and how these changes are going to help us grow our business as we move forward in the future. First of all, we are seeing a major shift in the population. Seniors will soon outnumber the young. Over the next 2 years, millions more seniors are going to need help. So the demographics are certainly in our favor and will support continued growth of the home care industry. The second big opportunity is what's happening in healthcare. Governments, payors, healthcare providers are all looking for community-based care solutions that will help improve patient outcomes and reduce costs. So people are waking up to the fact that what we do in the home fills an important role that they cannot fill. But the question is, are you engaged in your communities in a way that opens you up to these exciting opportunities that can really impact your business? Do you have the relationships with the right people who are looking for solutions that you have to offer? If you don't, someone else will. And so we're going to talk about our program today to help set you up for success. So definitely the demographics point to the increased need for senior care. What a great place to be as a provider. We are never going to be out of a job. And as I said, there's a societal shift from one dominated by youth to one characterized by older versus younger. 10,000 people a day are turning 65, and at the front end of that baby boomer group, which we hear about all the time, is the fastest growing age group, which is amongst 80 to 85-year-olds. People are living longer than they've ever lived before. Now, when we look at that 85-year-old group, they are on pace to triple by 2040 and reach 19 million by 2050. Care needs are rapidly on the rise. And back to that 85-year-old group, 65% of those folks will have some form of dementia. If we look at just Alzheimer's, it's going to double by 2030 and double again by 2050. So there is definitely a looming care crisis in store for this country. And of course, with that brings opportunities for us in our industry. If we look at that age group of 65 plus, right now, at any given time, 40% of those adults are needing care. They're needing assistance with their ADLs. But nearly 70% of all people that reach that age group will need care at some point in their life. Now, many of us have aging loved ones in our own families. In fact, this is a growing concern for families. It's often referred to now as the new female problem. And so the burden often falls to families ill-equipped to care for their loved ones. 75% of caregivers are women, typically the eldest daughter, right? We see it all the time. They're the ones that are calling your office. Care is being provided now in this country in 1 in 4 homes. So most of the care is still being provided in the home. And billions of hours of unpaid care is being provided. On average, a family caregiver will provide 22 hours of care per week. And 25% of family caregivers will provide 44.9 hours a week. Keep in mind that 74% of caregivers are still working a full-time job. So this is very, very challenging. I've got 2 employees right now within my own marketing team who are dealing with this in their own families. One mom just got home from the hospital today, as a matter of fact. So now, as we look forward, folks want to age at home. That is the movement, right? Is this aging in place movement. Most people want to stay at home. In fact, 4 out of 5 people in that age group believe that their current home is where they will always live. But there are going to be some challenges as we move ahead. There are so many folks that are going to be needing assistance because of the demographics. Chronic conditions is exploding, and so it makes caring for folks much more complicated. And then we have an increased need for assistance at home, but there are gaps in the support system. I'm going to talk a little bit more about that in a second. So by 2030, the need for home care, that's care at home, is going to rise by 400%. So there's going to be more and more pressure on families and folks just stepping up to the plate, even with neighbors, aunts, uncles, those kinds of situations. Healthcare providers can't ignore the need for help amongst their patient group, and they will see several people a day who will be needing assistance. So who's going to provide all this care? It's not going to be the family as we've seen in the past, because there is a major gap in the support system that's emerging. So it's really going to, there's going to be a lot more opportunity, as I said, for home care providers. So what's happening? There are gaps out there. So first of all, the base of family support is shrinking. Families are getting smaller. I see this in my own family, right? We'll see folks that we've taken care of who are one of 8, 10 siblings, and they have 4 children, and those children, families are just getting smaller. You see it all the time. But it's going to go from 7 to 1, so 7 people in the family to support 1 senior, to 3 to 1 by just 2030. And then we add the distance now that we have between family members, which is growing. Right now, the average is 280 miles to the nearest child. So that definitely impacts their ability to provide assistance to their family members. Not to mention that this generation does not accept the responsibility for their parents' care the way the previous generations did. So for those of us who have children, they may not be looking to take care of us the way we maybe took care of our parents. So that's something to be thinking about. So the care crisis is really going to create a big opportunity for providers like us. But you have to have the relationships with the doctors and the healthcare providers that see these people and who are in a position to recommend your services as those needs increase. So my first challenge today is, do you have strong relationships with those in your community who interact with seniors and or their families who are in need of help? Doctors, home health care companies, therapists at rehab centers, hospitals, social workers. Do you have enough of these people who really trust you and are referring to you on a regular basis? So we have this exponential growth in the senior population that is very good for our business as we look ahead. At the same time, we're seeing a major shift in the healthcare arena, and that's moving toward a more patient-centric, community-based model. That is very good for us. This is what I'm so excited about. Why? Because healthcare providers are looking for partners to help them better manage their patients. There is a push toward quality care versus quantity care. And we haven't even seen anything yet. We're just scratching the surface of what's happening in the healthcare industry. So quality is now going to be measured by patient outcomes. Healthcare providers are going to be accountable to results, to patient outcomes. And so there's a mandate now from CMS toward care management, which encourages providers to cooperate with other providers to ensure better care, because that leads to better patient outcomes. What do I mean by patient outcomes? Less complications, less hospitalizations, and ultimately less costs. So there's definitely going to be a movement toward partnerships. So why is CMS doing this? Well, they know that what gets measured gets managed. And their belief is by managing care better through a more holistic approach, they're going to save money. So let's face it, money is the driving force in this changing landscape. You have this huge aging population, and there aren't enough young people to pay for the system. That's what we need to understand. So CMS has introduced a new payment plan that rewards doctors for good outcomes or penalizes them for poor outcomes. And this is not just doctors, by the way. This is SNFs, this is hospitals, everyone that relies on Medicare. So this new merit-based incentive payment system, which is referred to as MIPS, incents doctors to provide better care management, care coordination, care planning, patient engagement, engaging the patient in better managing their chronic condition, disease management. Do you know that most Medicare costs are related to diseases around chronic care management? 2/3 of seniors have 2 or more chronic conditions, and so they're putting a lot of emphasis on disease management here. They're incenting doctors to use resources and make referrals to people that can help on this care continuum. Patient and family education is also something that's being measured, and then medication management. So providing this level of service is ultimately going to lead to fewer adverse events and hospitalizations, and ultimately reduce costs. So I'm hoping that you're seeing how what we do every day, all of these things we actually do. And we can help our partners, our healthcare providers, meet their goals for better patient management and ultimately better outcomes. So what's happening is in physicians this year in 2019 are actually going to be feeling this for the first time. And how they are either rewarded or penalized this year is based on what they did in 2017 around their MIPS scores. So what's happening is physicians are now on the hook. If their patient ends up in the hospital, that's a ding on them. So they're forced to be more involved and better manage their patients and those chronic conditions. Yet, let's face it, patients spend very little time in the doctor's office, right? So where things go wrong is in the home. And the doctor has very little knowledge and control over what happens outside of office visits. That's where we come in. Home care has proven to improve outcomes and reduce costs. And so we're seeing a move toward Medicare Advantage plans, looking at covering the cost of home care. We're not going to talk too much about that today, but that's definitely coming down the pipe. But from our perspective, now is the time to move those relationships that we have to partnerships, because these providers need us. They need you because you're in the home where they are not. You fill that gap in care that they have no control over. So we've got to be partnering with doctors, with health centers, with ACOs, with home health care organization, rehab centers. Everyone is going to be paying a lot more attention to what we bring to the table. So why is this important to us from a marketing perspective? Well, this is where we have to compete in the future. We want market share. We want to grow our business. And so we've got to be at the table with these folks, developing these relationships and partnerships. We want to be part of the solution, and we want to solidify our place in that care continuum. If we don't, someone else will. And that's what you need to hear today. So my next challenge is, how many of your key referral centers or referrers see you as their true partner? Are you an integral part of their workflow? If it's not you, it will be someone else. And so we need to be having those kinds of conversations and weaving these messages and what we do and how we can help them improve outcomes into our discussions with them. Do they see you as a partner, and what is it going to take so that they do? That's where we're going. All right, so really to compete and succeed in this new paradigm, You have to have a strong community presence. You've got to have a dedicated marketing person that is interfacing with these folks at the senior's point of need. And that's to solve the problems that they've got with the seniors and their families. And we want to be standing arm in arm with providers who are responsible for what happens to their patient. What we want to do is meet them in the middle. And because we have these relationships, we're going to move them to partnerships because we are their value partner in the home. All right, so that's kind of where we're going, and I'm so excited because for the first time, as I said, they are very interested in what we have to offer. So as I was out in the field myself, and I started my business and pounded the pavement myself for the first 2 years to build my business before I brought on other marketers. But my aha moment was when I realized that marketing meets strategy at the point of patient need. Okay, and so my goal from then on was to dominate at that point of need. And what I mean by that is calling on those folks in the community who engage with these people at that point of need, where the patient or family has come face to face with the crisis. This is the pool of the hot leads. This is where you get the long hours. So let's look at a typical scenario and why this is important. In the private pay world, and as Grant said, most of my business is private pay, it's really crisis driven, right? So what we need to do is be at that point of crisis. So what happens? The older person typically will have something that goes wrong. It's a fall, it's a condition, whatever it might be, ends up in the hospital, and somebody from the family gets involved. And they've got a dilemma on their hands. What do I do? It's the wake-up call, and now they've got to react. And so what they will do is as they work through this dilemma, they'll be interfacing with a lot of people who have the opportunity to make recommendations, sometimes even mandate certain care that's needed if it's in a facility, for example, or strongly suggest what needs to be done. So you may have the discharge planner at the hospital that's saying, look, mom can't go home alone. Or the social worker at the rehab center that's saying she's going to need 12 hours of care, all the waking hours. She needs somebody with her. It could be the therapist at the home health company who notices that she's not taking her medication and isn't keeping up the exercise regimen. It might be the director at the ALF who wants mom to come back, but knows according to regulations she's going to need an increased level of care that they just can't offer. So these people have the ability to influence their patients and families to call you. That's the name of the game, right? Well, and if they don't get any answers, they will at times reach out and look on the internet and look for a provider. But for the most part, they just don't have time. They're in the middle of this crisis and they need a quick solution. So they're really looking to the healthcare provider. Now back to those partnerships. They're obviously going to recommend those partners that help them improve their outcomes, right? So there's going to come a time, if you haven't already experienced this, where these partnerships are so strong, you may have a contract, they may be preferred provider. We've got several of those in place now, where you won't be able to break through if they already have a care partner on board. So that's why it's so important to be engaging with these folks, because it actually creates this barrier to entry. Why is that so important? If we look at the overall home care industry, 80% of revenue is actually generated through these kinds of referrals. 20% comes from Google, pay-per-click, etc. Okay, and I'll speak to this in a minute, but I actually am spending absolutely zero money on pay-per-click anymore. So these folks represent 80% of the revenue across the industry. So we want to be influencing that, right? We want to have those relationships, sort of own those relationships, and be the dominant player with those folks. So I believe that it really does take feet on the streets to really grow your business into that higher dollar, higher volume private pay categories. There is a big difference between a referral from a trusted healthcare provider and a pay-per-click Google lead. All right. And so, as I said, most of our leads are coming from these kinds of referrals, and often we schedule the appointment and we sign the paperwork because they have done such a great job advocating for us. Now, don't get me wrong, you've got to be online. You've got to have a website. You have to be present. If they look you up, they've got to be able to find you. And so, but warm leads are 30 times more likely to convert to a client. All right, so what happens is a lot of times, because folks maybe are uncomfortable about marketing, don't know how to direct their marketer, etc., they put all their eggs in one basket. That's the Google basket. And yet you're competing for only 20% of the pie. And you've got tire kickers over there, right? Shopping on price, calling every one of your competitors. They tend to be shorter, and they're usually not ready to start right away. Versus those that come from the referral, they're crisis-driven and ready to sign. All right, so as I said, you don't want to put all your eggs in the SEO or pay-per-click basket. So I challenge you to put your money where the opportunity is, and that is into local area marketing. A plan that helps you deepen your relationships with those key influencers at the point of need, and then work on turning those relationships into partnerships. So that's definitely what I've done over the years, and it certainly has paid off. Now, having marketers comes with its challenges, and I know that over the years I've had my challenges, and my system has really helped me with that. When we began to commercialize 52 Weeks Marketing, we realized there was a real unmet need for marketing support amongst home care owners, and this is why I'm so excited about what we do every day. They see the light bulbs come on, and we make their job so much easier. It's very exciting, because what we found is, and statistics tell us, that less than 3% of home care owners have a sales and marketing background. I was very blessed in my experience. I had about 17 years of pharmaceutical marketing experience that I brought to the table, and so that really helped me structure the program and attack my business the way I did. But it's no wonder that owners struggle to hire and keep and motivate a marketer if they've never been out and done sales themselves. And so if they struggle, typically they'll allow all those administrative tasks get in the way and pull them into, putting up the daily fires, because it's easy to concentrate on those things and not get out and do the marketing. So here's what we found. A lot of folks don't have a dedicated marketer. They don't have a local area marketing plan to grow their business. There's no time to manage marketers, and they're not even sure what to do and how to do it. No step-by-step weekly process for their team. No established accountabilities and tracking. And Linda said that was one of the things she was really excited about, because she knows that's a real struggle for a lot of folks. They don't have any materials. Now, you might have a brochure. If you're part of a franchise system, there may be a library of things, but what do you have to do? You have to sit down, you have to call those up, make the changes, send them to a printer. Who has time to do all of that? It's challenging. And there's definitely, if you've got more than one marketer, it's hard to keep that consistency and have your team working from the same song sheet. And certainly, you don't have a systematic approach to creating a business reason to be there on a regular basis. So we're going to show you a lot of how our program really meets this. So what's really missing is the how-to marketing roadmap, and that's what we're going to talk about, is a plan to follow that gives you the confidence to market your business and hire a marketer and drive your business forward. So let's talk a little bit about what that looks like. So the 52 Weeks Marketing Program is designed to support owners and their marketers, and it's really based on a business-to-business model. And what I mean by that is we want to influence the influencer. It's very similar to the pharmaceutical model. So what we've created is a turnkey sales and marketing system that's easy to implement, provides structure, has the customized tools and a powerful CRM. Most of all, it creates results. So let's talk about what that is. So what it does is it helps you Develop those deep relationships that you can transform into partnerships. Definitely gives you a point of differentiation. It's focused on patient and referrers' needs, and it creates customer loyalty because it's very solutions-based marketing. So I'm going to give you a really quick overview here of the program, as it's a multifaceted program. It is built around a monthly toolbox of materials. Okay, so there is a different tool for every week of the year, and hence the name 52 Weeks Marketing. And we have a strategic roadmap that the marketers follow, so they know exactly what they're doing every week. There is a messaging sheet that they follow, and they actually have verbatim messaging of how to leverage the tool into a very relevant conversation with their referrer. There is software that keeps the marketer on track, and in real time you can know what the marketer has done today, what kinds of meetings they've had, who they saw, etc. And then ultimately there's the sales and tracking and reporting. So with the system, you definitely look different than anybody else out there calling on these healthcare providers. There are 33,000 home care providers in the USA, and really we're all kind of saying the same thing, but the program really gives you something new and different, and you definitely look different than anybody out there. So let me give you a little bit of the philosophy behind the program. And this is a philosophy whether you have the program or not. This is something to be thinking about when you are structuring your marketing program and getting your marketers out there. The first thing is based on reach, okay? Reach, frequency, and consistency. Marketing is the process of building a business relationship with potential customers. Relationships grow as a result of frequent contact over time. Do you know that somebody has to hear a message 7 times before it sticks? So we've got to be seeing them often enough, and we're going to talk about that. So reach. What we mean by reach is seeing enough people, giving you that wide enough breadth of referral sources that keeps the pipeline full. All right, because there's a natural ebb and flow that happens out there with your referral sources. It might be one rehab center that you work with that you haven't had anything from them for a month, and the next month you might get 3 or 4. But you have to have enough of those that are constantly referring to you to keep your pipeline full. Now, reach without frequency is a waste of money. All right, if you just you see them once every couple of months, it's not even worth it. So the frequency we need to be seeing at least once a week to your key referral sources. So in terms of reach, we want 75 relationships, folks that you're calling on, and be seeing them once a week. And the only way that you're able to do that is with a geographic route. Having them organized in geographically so that they can get to see everybody on a weekly basis. Now, that's the easy part. The challenge is, well, what do I talk about with these people every week? And that's where the toolbox comes in of tools, with a different message and a different tool or collateral piece that you're able to leave behind every single week. And these tools are relevant, they differentiate you, they benefit the referrer, they benefit the patients, and they're really creative. Now, I often get asked the question, well, how is my marketer going to get to 75 people? It's easy. I'm not saying 75 stops a day or a week. In one center, for example, you take a rehab center, there are several people in different positions that you will see in that one stop. For example, they may have 4 discharge planners, 8 to 10 therapists, several director of nurses, etc., as you can see on the slide. Well, in one stop, your marketer may see 5 to 10 people in that one influence center. So it's very doable. As a matter of fact, my folks have 100 people in that they're calling on a weekly basis. So 5 key components to the program. There is the monthly toolbox, that different tool and a different message for every week of the year. There is the messaging sheet, which is really the roadmap. They know exactly what they're doing every week. There is a monthly training webinar where your whole team gets on and learns about a particular theme that we're talking about that month and sees how and what the marketer will be saying out there in the field. There are care management tools and training materials that you'll be able to use with your caregivers and your operational staff. And then finally, the CRM, which helps set and keep the course for success. So the program is the year that's all planned out. Each month is built around a theme, typically related to a chronic condition which drives those long hours, and it focuses on that care management piece that is extremely relevant to care providers now with the changing landscape. So it's a different theme every single month. The messaging sheet is that roadmap to success, as I said, and it outlines what tool to use each week. And as you can see, there is verbatim messaging that your marketer will use to leverage that tool into a great conversation about a particular patient that they see that has needs that you have solutions for. And then we always recommend, and in fact in the messaging sheet I show them how to ask for the referral, how to transition to that. All right, and then finally, every month begins with that webinar, as I talked about. And so this is delivered to your mailbox every Sunday before the month begins, so that you can get your whole team together, take a look at the month ahead, and everyone is on the same page. You know exactly what your marketer is out there promising, so that you can live up to those promises. Okay, so now I'm going to turn it over to Graham, and he's going to talk to you about the CRM program and how that can help you hold your marketer accountable and keep an eye on how things are going throughout the week.
Okay, I thought by giving you guys a snapshot of some of the functionality of the CRM software, it also helps by way to explain the system and the structure that goes into this. And Debbie's done a great job sort of outlining the key of the having the materials, having the messaging sheet, highlighting what to say and what to ask, and the webinar that all your staff members can view. The aim is to have all your team on the same page, and not just the marketer knows what's going on as well too. So let me just take you through some of the features of the CRM. So what the CRM software does, and part of what we help you with is how to go about building and defining a database of what we call influence centres or healthcare influence centre types, such as rehab centres, hospitals, independent living facilities, and so forth, where most of these referrals come from that Debbie's talking about, but at the same time build a database of referrers inside those influence centres that are the key people who are referring to home care on a daily basis. So one of our target numbers around the number of healthcare influence centres that needs to go into the database that we're going to help you build is around 45 different influence centres across 16 healthcare influence centre types of those that I mentioned before. Then what we're going to do is to help you build around 85 key referrers within these centres, because you can't just rely on one contact in an influence centre. What you need to do is to build your relationships by referrer and give you some breadth within an organisation to give you some real power and clout. So effectively you own that particular influence centre or facility. So our system helps sort of guide, and we've identified 46 different position types across these 16 healthcare influence centres where most of the referrals come from on a daily basis to home care. So what the software does, it tracks the daily activity of the marketer. And what I'll say also is that once the influence centre and the referrer databases are uploaded into the software, there's some key triggers that automatically route the where to go on a daily basis into a geographic sort of sensible visit schedule. So on a Tuesday, you might be seeing the north part of your marketer's territory. Wednesday might be the south part, and so forth. With Monday really being a focus more on meetings and a few marketer making appointments for the rest of the week to meet the 75 visits that Debbie's talking about, with 75 individual materials every week of the year. So what the software does, it enables you to track referrals and leads. So referrals meaning coming from the marketer, leads meaning those that go into your office, that the intake person, or whatever you call that person, is going to be gathering as well. So it enables you to also communicate with the office regarding new referrals and receive updates on progress of referrals. And the reporting is effectively daily. but you've got very dynamic weekly reporting covering off key performance indicators. So it helps the marketer, it holds the marketer accountable for activity and results. You can see what's going on in real time. It's real-time access to what the marketer is doing in the field. And I think the important thing is that you own the data and the relationships, they remain with you. So some of you may have experienced a marketer leaving your organisation, and what they've done effectively is to take the database and the referrer relationships with them. So you've sort of got to start all over again, which sometimes becomes a reason why you don't want to hire another marketer. Okay, just a quick snapshot. This is the template that you'll see within the software, and each company has their own logo, the marketer name, and the messaging sheet and the toolbox webinar that Debbie just went through before are available within the software as well too. So really what we're creating with you in your own business is a distribution channel where every person has a stake in what's going on, whether it be the conversion of leads coming to the office or whether the marketer working on the referral. So it links up the agency with the sales manager, if you're large enough to have one, with the marketer, the lead coordinator, and the assessor, who is really helping close the loop on the outcome of the referral going to the next stage for assessment. So it's a database of key targets. We use a routing system, in short, that you see your targets each week. It's daily activity tracking with a point system. It's referral and lead tracking. So as I said, the marketer and the office intake person and the weekly reports that specifically cover marketer activity, referrers and influence center analysis. So you see the top 5s of each of those in a snapshot by row of every visit, and the tracking status of referrals and leads as they come into your system to become a new client. So I just want to quickly go over some of the databases. This is very much about what data that you put into the software. If you put in the right data and it's comprehensive, you're going to get great results. So it starts with what you're doing is building a database of the personnel who are going to be using the system. Effectively, what you're going to be doing with your prospects, you're going to be owning all the contacts, if you like, contained within database within your marketers community. So it's the influence centers, it's the lead sources, it's the referrals, the referrers, and even residents in independent living facilities if you want to go down that pathway. We've even built in a way in which you can start to identify prospects from the events that you run. So it might be a lunch and learn, it might be an expo or a CU program on dementia or a senior day. But now we've got a way in which you can capture those contacts and put them into a database and actually work out what you want to be doing with them as potential prospects. So the system, as Debbie mentioned, is gamified. So there are different types of activities that we think are really important in home care. One of the most important things is to schedule an appointment because that translates to real value. So if a marketer schedules an appointment, they get 2 points, but if they turn up to that appointment and it converts to a face-to-face meeting, they get a further 3 points. If that person's not there, however, they'll still get a point for dropping something off. Networking events are 5 points and presentation to groups, and conducting events are 10 points. So what we're looking for is a 100-point target at the end of every week. So you're going to keep your marketer accountable that way. The daily calendar is what your marketer will see at the start of every day that comes out of the routing organizer. And if you've got more than one marketer, or even if you've just got one marketer, there's a dashboard of the marketer's activity around their activity points in real time as well too. And you can see 2 or 3 or 4 marketers if you've got more in that same section. There's a follow-up section too, because we know that, you know, once you've met with a referrer or even had some conversations with an attendee to one of your events, you want to be able to follow up. So it codes that we help you sort out and define your marketer's territory too, and normally that's a number around a population of 300,000 because a marketer is going to struggle to work an area that's a lot bigger than that. We can talk further about this another day, but we've also introduced a way in which you can process BA benefits and long-term care insurance, where the marketer can answer a few simple questions that are built into the software and literally push that information off to one of our partner experts in those areas to approve and ultimately fund on your behalf and pay you to provide service really from day one, effectively, to those type of clients. So it's the result meters, and there are also the route organizer I've covered. So activity points every week. You know, you might find that you've got 45 influence centers and 85 referrers in your database, but you're not necessarily going to be seeing them every week. So we've got a way in which we can look at the influence centers and referrers that weren't visited, and there's a whole bunch of other great reports for sales management and owners to use as well. This is a form that that we use. It's a form that the marketer uses for their referrals, but it's also a form that the intake person in your office can use to process. So what we're effectively trying to do here is to get both marketer and leader intake person on the same page, but this is also the data that you're going to be entering into your system. And look, I will point out that, and you probably know this already, but within the Rosemark system, there is an inquiry tab where the data or information that you collect on this form can be entered as well. So I just wanted to point that out. Okay, so what we're doing here is really collaborating with Rosemark. So we're looking at helping you get a whole bunch of leads and referrals and information and build those databases that are the building blocks for what you're going to need anyway. Tracking the market activity, tracking the results, and really the ability then to be able to put really quality data and a lot of quantity of information into the Rosemark system to take it from assessment and move it forward. So really what you know, just there's not a divide between the systems, because fundamentally our systems do very independent things, but they really have the ability to talk to each other where you guys are in the driver's seat. So ours is about marketing and sales activity. Rosemark is about caregiver and client management. In fact, the best system in the country, you guys are using it right now, Rosemark. Our cost, $660 per month. And we're just going to do a quick comparison. If you were to try and produce 75 pieces of each weekly material under a monthly theme and to be doing all the things that you need to do, it would cost you nearly $3,000 just to do that component. So it's not feasible. The second part is that what Debbie's outlined, we're providing the monthly roadmap and messaging, the monthly training webinar, the onboarding templates, and the sales management software. So and the whole year is all planned out. You really don't have to do anything, and it's delivered to your door. It's absolutely priceless.
So what we're talking about is something that takes you from concept. So back in the day when you've hired a marketer, we say, well, go see referral centers and get me some referrals, to this system which says, go see these centers and visit people in these positions on this day of the week with this tool and say this about our business. So it's very, very planned out and systematic for them. So what do you get for your marketer? You get a 12-month structured program to keep the marketer 100% focused on sales and sticking to the route. You get a comprehensive database of all your referrers and influence centers in your market service area. You get 52 weeks of relevant customized marketing materials, messaging. By the way, I just want to highlight that customized. This is for your office. This is with your logo, your office information. This looks like it's you. It's coming from you. It is. It's coming from you. The monthly webinar, that's the training for the whole team. And then the fully integrated CRM software sales management tool with the weekly reporting functionality. So basically each marketer has their own materials and software and ability to track activity, use the materials and get results. And let me tell you, they will thank you for this program. So in terms of planning, a failure to plan is a plan to fail. So we've got to decide what your goal is, articulate that to your team, and be sure that you're structured for success. And this is what the program is designed to do: help you create a route, give you the tools and materials, and then help you track the progress.
Okay, so I'm going to get you guys to the offer, what we're offering here, and what we're able, and some takeaways for you as well too. Before we, at about 5 minutes to 4 o'clock, we'll have time for Q&A. So let me just quickly take you through this. But if you've got your phone in front of you, I just urge you to take a photograph perhaps of those contact details right there. Okay, so what we're offering is the first 40 marketers, and some of you might have more than one marketer. Some of you right now may not have a marketer. So what we're going to help you do is get to a stage where you can comfortably bring on board a marketer knowing that you've got a great system to be able to migrate them into. So our first offer is really to, and there's no obligation to this, is to do some territory mapping appraisal. So help you really focus and discover where most of your business is coming from right now, and really build out a territory if you don't have one already for your marketer. Provide the hands-on assistance with database building of healthcare influence centres and referrers. This is the key. Without the building blocks and these contacts, it's very difficult to get the results that you want. The route planning to enable 75 visits per week, and just imagine that, and I guess some of you are probably trying to compare what your marketer might be doing now to this number and going, well, how can we do this? And of course, automatic access to the long-term care insurance and VA benefits portal that we've built into our system before. So best email address to contact us on is sales@52weeksmarketing.com, and you can request anything that you like. We've also got our website, which is www.52weeksmarketing.com. If you go to the Contact Us page, there's a whole bunch of different things you can do there as well too. Now, I'm going to come back to this slide in just a moment, but what I want to give you right now are 5 takeaways to implement today. In fact, there's 6. So the first one is to focus on your best referrers. They trust you already, and they can refer you to other referrers, particularly within an influence centre that you're already servicing. Recognise and thank your referral sources. I mean, we take this for granted, but you need to close the loop and update your referrers on how that referral went. Get your contact information on their phones. Well, you know, once you're in their phone, you're in. So that's really important too, if you can achieve that. 4 is to create referral marketing materials yourself. Now, we've got great marketing materials, but you might want to take a step before that. So if you don't have the budget for 52 weeks marketing today, try and do something at least once a month for yourself. Make it easy for them to refer. So create a template or a form that they can send you to get things going when they've got a referral. Just little innovative things like that will make a difference. And finally, give them a little something extra. So you might be able to help them out with something. They might be running an event, it might be a lunch and learn or something, or you might want to conduct a lunch and learn, for example, again, in their business. The other thing that, and we've been through the referral and the lead intake form, but if you want a copy of this, I can send this to you directly, and you can start using this tomorrow. And I'd suggest that this is a great way of sort of gathering all the information, and even start getting your marketers to use it as well too, even if you're not using our system. We just recommend that this is a really good template for you to use. The other thing that I think is really important too is the business growth projection target form. This is the real sort of way of really having a look at how things have been going for your business over the last few years. And we can send this out to you as well too. And what we're happy to do is to conduct a free business growth projection evaluation to help prepare you for a 52 weeks marketing system, or just to help you with the direction of what 2019 is going to look like for your business. So as I said before, these are some great contact details. Take a photograph right now of this, but I do know that this session's being recorded as well too. And what I'd like to do right now is really just open it up for questions and answers.
That was wonderful, thank you. I'm going to take a look and see if we have any questions that have been written down, but if anyone attending does have questions they'd like to ask, just go ahead and raise your hand, we'll unmute you, and then Linda will field any questions that might come through. So anyone with questions, please go ahead and type those in, or raise your hand, and we will go ahead and unmute you.
So while we're waiting on that, Debbie and Grant, I have a couple questions for you. So I can almost hear my customers saying, well, currently I'm a little afraid getting new clients because I'm having a hard time getting caregivers. And I guess one of the things that comes to mind for me is that a lot of the times the reason that you are losing caregivers, say from an inquiry, is that you can't put them to work quick enough. So it's a chicken or egg question, wouldn't you say?
It absolutely is. The best way to keep a caregiver and to hire and recruit is having the hours to give to them. So, and I'll tell you, over the years, we've had different managers in different offices that we have across the city. And one of the key things I always drive home is never stop hiring caregivers, never stop marketing. You've got to keep those two engines going. And that's one of the key things that we use for recruiting is, look, you want to come and work for us because we're the company that has the hours. Why? Because we have 4 full-time marketers out there driving business, and they sign on.
And fundamentally, if you're not growing, you're not growing. And what that means is you're waiting for the day when some trouble's going to strike your business and you're in trouble and you have to exit without any choice. So you don't want to ever find yourself in that situation. What you want to do is to challenge your business to keep up to your marketing effort, and operationally and with caregiver hiring, as Debbie's outlined. So that's the challenge of growing a business. If you're not growing it at the front end, it's certainly not going to grow at the back end.
So it looks like we have a couple of questions coming in. One from Tracy, who says, is this program targeted towards the American system?
Yeah, because Tracy's agency is in Canada, in Vancouver. Any thoughts about that?
I'm actually Canadian, Tracy. I'm originally from Canada. But yes, it is mainly, and it will absolutely work, except there are certain words that I used to spell according to the Canadian system, and now spell through American. So the only difference would be some of the words are Americanized, like favor, O-U-R, and O-R versus O-U-R.
If Tracy could live with the American spelling on the materials, then we have no problem at all. It's just to be able to sort of re-engineer all the materials would be difficult.
Wonderful. Okay, now we have a question from Justin, who's raised his hand. So Justin, you're unmuted. Go ahead and ask your question.
Oh, great. Well, your presentation's wonderful. Thank you. I do have 2 questions. One, if we were to invest into 52 weeks, going forward, do we not use the marketing tools that Rosemark provides for us? I mean, I know you guys kind of addressed it, but what does that look like?
It's not one or the other. I guess what we're complementing each other. So, and our individual tools relate to our systems, but I think there's a great opportunity to be able to use both, to be honest with you. I guess what Debbie was saying is that you may not need to spend as much on SEO and pay-per-click. That's where there could be a positive impact for you, where you've got more dependency upon what you market and what you're doing within your own office to get the results.
Okay.
So Justin,
sorry, go ahead.
Robin over here at Shoshana. Real quick, I just wanted to jump in and say that I think that some of the tools do overlap a little bit, but there is quite a bit of compatibility that both systems would have together. So that's something that we could look at more in depth to see what the process would work for you.
Yeah, and currently we don't have any kind of an integration, but I can say that, this is Linda, that we have mentioned a little bit, talked a little bit about that with Grant and Debbie. So I think it would just really depend on what our customers are asking us for. So you know what that's like, right, Justin?
I sure do. Yeah, no, I appreciate that. That's great. I love to hear that. Yeah. I mean, an integration of some sort would obviously be wonderful. I mean, if our marketer was in, the nursing home or something, and they had a referral, and I was able to push over to Rosemark and populate that information, I mean, that would be pretty powerful, I think. So.
Oh yeah.
Yep.
I do have one other question.
Yep, go ahead.
I'm just curious if you guys have franchise benefits as a franchisor that might want to offer or come alongside with, for their franchisees, if there's any benefits, or if you guys have done that already to this point.
Yeah, are you part of a franchise system?
We're in the process of franchising right now.
Okay. Yes, we actually are working with a franchisor, and we love to do that because there's such a benefit to working with a whole team, and from a branding perspective makes our job a little bit easier, but also we can be very branded and specific to their needs. So definitely open to working with a group.
Okay, great.
Thanks, Dustin.
You're welcome.
All right. Here's another question from Mike. He says, healthcare workers, referrers tend to change positions frequently. Is it pretty simple to move people from company to company in your CRM?
Absolutely.
Also, what's the minimum contract?
And what's the minimum contract length with your program?
Okay. Yeah, what we've built into as we've mentioned up front, Debbie's had 10 years experience using this, so her marketers have had a lot of input into what we're doing from a software point of view too. So what we do, and we know that referrers move around a lot. So really what we do is retain that referrer's record, and I won't go into too much detail, against that influence center. Then if they move somewhere else, we're tracking that. And if they're replaced by someone else in that influence center, because that's the position that we've targeted, that's covered as well too. But typically our agreement, it's a 12-month agreement with monthly payments.
Great. We have a question for Paul. Marketers that don't come into an office daily, how do they enter their information?
It looked like you had some kind of an app, maybe a phone app?
Yeah, there's two ways. There is an app. There is an app, and the app is really designed so at the end of a meeting they can go into their app and update the outcome of that meeting and get their points accordingly. But the web browser is the other way of doing it. If you were to go into our contact section of our website, 52weeksmarketing.com, you'll see there's a member login as well too. So that's sort of where you do the heavy duty work from. But if your marketer's got an iPad or an iPhone or a device, there's an app that's also available for that. And some of the marketers decide just to continue to use the web browser even though they're using an iPhone. So
yeah, my team used tablets. Works great.
I was thinking about another issue that I think comes up with people trying to make an entrance into I think you call them centers. You call them
influence
centers where there's a whole bunch of different people. Like for instance, a hospital. There are many people within that place that care centers or whatever. So the question is, I can imagine a newer agency or an agency that hasn't done this much would go into a place and see that there's already another agency who has their information around and get intimidated by that. Am I right to think that this day and age that places like that are looking for multiple agencies to partner with to refer their business to?
Let me answer the first part.
And they shouldn't be intimidated by that?
Let me answer the first part. So there's always going to be plenty of people targeting, but the problem that most marketers have is around frequency and consistency of message. So let's say that you know that you need to be seeing a discharge planner weekly because they're discharging to home care every day of the week. You've got a marketing material with what to say and what to ask that gives you a business reason to be there every week. It's something to talk about every week versus a marketer from another agency who's really got nothing to talk about, who's saying, all right, well, I'm going to wait 3 to 4 weeks because I don't want to pressure them. So what happens very quickly is your marketer is top of mind, it's got something interesting to talk about, and you become the trusted provider.
Mm-hmm. Yeah, there's always competition, and what you're bringing is value added. A lot of the materials are very educational that can get passed on to the patient. They're focused on a patient situation or a need, And often they need to educate the patient about diabetes management, whatever it might be. And so we're the ones there with the tools that they're able to use, and they're the tools that have our name on it. So it's really the value added that's going to help you build those relationships. And what's really neat is for somebody that's new, it gets them in the door quickly. They have something to actually meet about because they have something to talk about. And it really makes them look different from anybody else because they're there to help their referrer solve the patient problems.
And the materials are branded too. So as Debbie said, they've got your company logo on it, might be the name of the marker or your office details and a contact phone number. So those materials are staying on the top of their desk and top of mind every day of the week.
Great. Thank you so much for that. There don't look like there are any more questions for now, and we're running to the end of our time.
So thank you so much. I think this is a really wonderful presentation. If anyone has any questions after the fact, you can always reach out to support@shoshana.com, and then also to 52 Weeks Marketing. Anything that comes to us, we'll obviously kick their way.
Yep.
And then,
yep. Grant and Debbie, thank you so much for that really valuable information. I hope that was so encouraging to our customers. This is not an industry that's going away anytime soon.
No, it's exciting.
Yes. All right. Well, thank you so much, and have a nice afternoon, everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.